Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Buspirone with a brand name of Buspar. Before we get into the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Buspirone is an agonist on the 5-HT1A receptor, and it's most commonly used for anxiety. The official indication would be that it's used for short-term symptomatic relief of excessive anxiety in individuals who have generalized anxiety disorder. It can also be used as an alternative to benzodiazepines. This would be most commonly seen when sedation or psychomotor impairment may be dangerous for the individual using the medication. This could also be beneficial in individuals who have a history of substance abuse. Buspirone is occasionally seen used to treat obsessive-compulsive disorder. It can be used in depression to help augment the effects of antidepressants. It is occasionally seen in social phobias, although the evidence is contradictory to whether or not it is truly effective. Individuals with premenstrual dysphoric disorder may benefit from Buspirone. It can be used to help treat agitation or aggression, antisocial behaviors, as well as sexual performance disorders. And lastly, it is sometimes used to help alleviate the bruxism that may be caused by SSRIs. Now, before somebody was to start using Buspirone, there are some precautions that they must be made aware of. One is that there's no cross-tolerance between Buspirone and benzodiazepines. Buspirone will not help alleviate benzodiazepine withdrawal, and when switching from a benzodiazepine to Buspirone, the Buspirone should actually be added while the patient is still tapering the benzodiazepine. Buspirone does not have anticonvulsant activity and has not been studied in patients with seizures. It is not recommended for patients with seizures. Now, once somebody is made aware of the precautions and they start using the medication, typically they would start off on a dose of 5 milligrams taken twice or 3 times daily. This dose can then be increased in increments of 5 milligrams every 2 or 3 days to a maximum of 60 milligrams daily. The usual therapeutic dose for patients is about 20 to 30 milligrams a day, or 10 to 15 milligrams twice a day. It should be noted that doses up to 90 milligrams have been used, typically in patients with severe depression that have a lot of anxiety as a symptom of their depression. Unfortunately, with Buspirone, it does take some time to work. It can be 2 to 4 weeks before you really notice that anti-anxiety effect set in. Buspirone is not effective when used on an as-needed basis. It must be taken consistently. The last thing to note here is that we would decrease the dose by 25 to 50% in individuals who have a creatinine clearance less than 10 mils per min. As with all medications, there are some adverse reactions or side effects that people may experience while using Buspirone, so I'll include some of those here for you now. Before I lift off the side effects, however, I just want to make a note that Buspirone causes little sedation, and it does not impair psychomotor or cognitive function. Now, about 6% of people experience headaches, while 12% experience dizziness. Lightheadedness happens to about 3% of people, and nervousness happens to 5%. About 2% of people may have this sense of excitement when they use the medication. And fatigue, numbness, as well as GI upset happens in less than 10% of individuals. Buspirone does have the ability to bind to central dopamine receptors, and this can cause some side effects occasionally, although not substantiated by trials, such as pseudoparkinsonism, akathisia, as well as dystonia. Again, I will say that these side effects are not substantiated by clinical trials. However, there is a restlessness that is sometimes reported upon initiation of Buspirone, and people do think that this is caused by its dopaminergic or noradrenergic effects. Buspirone does have the ability to cause mania when used in individuals who do have bipolar disorder. This seems to happen more commonly in the elderly population, as well as people using high doses of this medication. And lastly, there have been cases of Priapism reported. That's all we're going to discuss today with Buspirone or Buspar. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.